Mr. Sushil? Thank you. Thank you. All right. So we're here together today, and thank you all so much for joining us. Namaste और आप सबका स्वागत है इस वेबिनार में. My name is Shreya Mohan, and I lead communications at iForest. iForest is an environment research organization headquartered in Delhi NCR. We work across 8 states in the northern and eastern parts of India on a host of environment-related issues such as clean energy, air pollution, and waste management. We work with governments, industry, and civil society to put out our research and develop solutions. But we're here today for a very important conversation. Our life depends on it. India accounts for 2 million deaths linked to air pollution. Respiratory diseases, cancer, diabetes, neurological disorders, and heart diseases are all linked to air pollution. Apologies for this drilling sound that's coming at the back. So, हमारा इस research ये बताता है कि the problem of air pollution is not just with metro cities, but also in smaller cities. And in the smaller expanding cities are getting equally as impacted as, capital cities such as Delhi. Cities such as Patna, Guwahati, Meerut, Bhiwadi, Amritsar, Baddi, Ujjain, and Chandigarh, where our pollution campaign has focused on, we found them to be severely polluted. In fact, the AQI across the Indo-Gangetic plains is as bad, several times over WHO's permissible levels. In any other country, this would be a public emergency. So through our social media campaign called Smog Tales, Know Your City and What You Breathe, we're trying to shift and talk about the problem affecting smaller cities in India as well. इस चर्चा को दिल्ली की राजधानी से छोटे शहरों तक लेकर जा रहा है हमारी कैंपेन स्मॉग टेल्स. We want to take air pollution from the realm of expert speak to daily conversations. We hope to see our colleagues, friends, and family talk about the data and science, the causes and fixes, because this awareness is really critical to demand for change. Through our social media campaign, we hope to educate citizens, shape public opinion, and importantly, create conversations between residents, academicians, pollution control boards, municipalities, health experts, policymakers, and the media. And we are confident that these conversations can mobilize local action. I'd like to welcome our esteemed panelists who join us today to share their wealth of experience in combating air pollution. Professor Ravindra Khewal, Associate Professor of Environment Health at PGI-MER Chandigarh. Dr. Deepak Agarwal, Head of Department of Pulmonary Medicine, Government Medical College and Hospital, Chandigarh. Mr. Sushil Dogra, Scientist B at Chandigarh Pollution Control Committee. And we're also waiting for Ms. Pavila Bali, founder of the Run Club Chandigarh, who will be joining us today. I'd like to welcome my colleague, Dr. Pratima Singh, who is Director, Air Pollution and Waste Management at iForest, to make a presentation of our findings and moderate the discussion today. And I'd also like to welcome our participants to this discussion. Please drop your questions in the Q&A box. We've saved the last 15 minutes of this webinar to take written audience questions. Also, this webinar is being recorded and will be shared with the press and key stakeholders. And with that, I hand it over to you, Pratima.
Thank you, Shreya. Thank you so much for setting the context and the platform. I welcome all our esteemed panels and experts working in the domain. I'll quickly share my screen. Let me know if it's visible. Is it visible, Shreya?
Yes, it is visible.
Okay, perfect. Thank you so much. So today we are going to focus on Chandigarh. We have done this webinar for, as Shreya mentioned, for smaller cities like Patna, Guwahati, Meerut, Baddi, Bhiwadi, and now it's Chandigarh. Chandigarh definitely is not a small city, but it is very interesting considering that it is right next to Punjab and, very similar in terms of infrastructure like Delhi. So we wanted to, look at Chandigarh. So I'll just quickly take you through some of the pictures that I clicked when I was in Chandigarh and some very interesting things. There is this tower which probably, is helping to clear the air. That is what I assume, but I'm sure it does not as per the science. These are some very interesting news articles there were, and I have just captured the headlines where Chandigarh has been in the limelight for increasing air pollution. Today, the AQI levels were in unhealthy range, and this is a common sight during winter time. Garbage is one of the challenges that is causing the air pollution in Chandigarh. So, for our study, we focused on continuous air quality monitoring stations. There are three monitoring stations in Chandigarh. We did not focus on the manual monitoring stations because we wanted to analyze huge amount of data and see how it speaks. So, these are the locations of the three monitoring stations. I'll just take you through the approach that we have applied. So we collected the 15-minute interval data for five pollutants, PM 2.5, 10, SOx, NOx, and ozone for Chandigarh. We tried collecting 5-year data from 2019 to 2023. However, in the case of Chandigarh, we could not get good data for 2019, 2020, and 2021. It was less than 60% of what our criteria was, and hence the 3-year analysis is not mentioned in this presentation. So we will be focusing on only last 2 to 3 years of data assessment that we have carried out. And the data that was collected was, using Python, we assess the data, and using various visualization platforms like Tableau, Power BI, and QGIS. We looked at various types of assessment, which I'll be presenting going forward. So what we found that the PM 2.5 and PM 10 levels for these three monitoring stations, the continuous monitoring stations as which are mentioned here, the red indicates the PM 10 values. These are the annual average, and the gray ones indicate the PM 2.5 values. The PM 2.5 values are not very high here. However, PM 10 are really, really significant. The population size is not huge, it's around 12 lakhs, three continuous monitoring stations. As per the CPCB criteria, Chandigarh fulfills the number of monitoring stations that are present in the city. It should have 5 manual stations and 3 continuous, which are present at present. So we looked at the annual average of 2023, and we can see that the annual average of PM 2.5 was around 60 microgram per meter cube, and for PM 10 it was 118 microgram per meter cube, which is way above the CPCB standards, which is for PM 10 60 microgram per meter cube, and for PM 2.5 40. However, NOx, SOx, and ozone, they were well within the CPCB standards. I was just looking at some analysis for Chandigarh city. I apologize for the background noise. It's a lot of construction happening around us, which is also another cause of pollution in our cities, and we don't have any control over it. So please bear with me. So I was looking at some of the neighboring cities in Chandigarh, which is Patiala and Jalandhar. And Chandigarh being one of the planned cities in India, which is so systematically structured, the pollution levels are still very high compared to Patiala and Jalandhar. In Jalandhar, there are industries. Patiala, there are a lot of industries, and we assume that these smaller cities, there's a lot of waste problem also in these cities, and their pollution levels will be higher than Chandigarh. However, Chandigarh is still high compared to Patiala and Jalandhar. So we looked at all the three manual, the continuous stations, and we found that yes, PM 10, PM 2.5 levels are really high. However, sector 53, the PM levels were high compared to the other two stations. And for PM 10, sector 22 station recorded high levels. So we need to understand what is happening in sector 22, whether there is construction, road, infrastructure development, what is happening. And same for sector 53. So we need to have some ground understanding also to pinpoint what are the sources of pollution in sector 22 and sector 53. When we looked at the annual trends for last 3 years, it was very surprising and interesting that though a lot of work is happening in waste management, though a lot of infrastructure development is happening to ensure that pollution levels are low, however, in last 2 years, the pollution level has just risen. It's increased. In 2023, for PM10, it increased. For PM 2.5 also is increased. And for 2024 also, it has increased by in the range of 5 to 7%. So there is no decline in the air pollution levels for Chandigarh. When we looked at the monthly trends, we know that in the winter months are really polluting because of a lot of activities happening in and around the cities, the stubble burning, solid biomass burning. So December month was really polluted when PM 2.5 and PM10 are considered. However, during the monsoon month, that is from July to September, we observed that PM 2.5 levels were well within the CPCB standards because of the precipitation, the pollutants settled down and the air was really clean. The ozone was really high during the summer months. That is what we observed. When we look at the hourly trends, yes, peak hours were observed during the morning and the evening time. However, very interestingly, evening time had higher peak compared to the morning peak. And we need to understand why that is happening. And it was for both PM 2.5 and 10, the evening peak was really high. And ozone was found to be high during the afternoon hours from 12 afternoon till 2 to 3 p.m. So the key highlights of this short assessment that we carried out that, considering Chandigarh surrounded by Punjab cities, it is more polluted compared to the neighboring cities. PM 2.5 and PM concentration have just increased over last couple of years, and they are, above the CPCB standards of 40 microgram and 60 microgram respectively. There has been decrease in SOx, NOx, and ozone concentrations by almost 17 to 25%. December is found to be the most polluting month for PM10 and PM 2.5. However, as I mentioned, during the the monsoon months, PM concentration for PM 2.5 were well below the national ambient air quality standards. Ozone, SOx, and NOx concentrations were found to be high during summer months, that is from April to June. PM was found to peak during morning and the evening hours. However, ozone was found to peak during afternoon hours. So I now open the floor for panel discussion to understand the trends that we are seeing here, the concentration levels that are increasing, and to understand what is happening in Sector 22 and Sector 53 in Chandigarh. Thank you. Now we'll move towards the panel discussion. I welcome all the speakers once again. Do we have? Yes. So I'll start with Professor Ravindra Khairwal, who is an expert in the air pollution domain, working extensively in creating awareness towards impact of air pollution on our health at PGMIR since last many years. So welcome, Professor Ravindra. As you have seen that the pollution level in Chandigarh has not decreased. It's just increasing every year. So could you please elaborate on why it is happening that, like, though so much of effort is being taken by the government, why there is no decline in the air pollution levels?
Thank you, Dr. Pratima, and I'm pleased to be joining this iForest event where I can see the top panelists from the region. So while talking about why the pollution is not declining, we have to understand that there is an increasing in the population. When I'm talking about population, that is linked with the vehicular density and their movement. Another thing is that Chandigarh is surrounded by developing region. If you come across Chandigarh, or listen to the radio, actually, you will understand that how many construction sites are there. So Chandigarh is nothing but covered by the construction site. So from now, if we look at from traffic, exhaust, non-exhaust, then construction site, then if we talk about waste burning, you will also see in certain pockets, basically, the waste is being burned, including the urban forestry waste. Means like in this season, we will see lots of leaves falling and they will be burned around. Now, think about the seasonal pollution like crop residue burning, depending on the meteorological condition, they will also contribute. So overall, if we look at the increased anthropogenic activities along with the meteorological phenomena, we are not able to see the impact of, you can say, NCAP or decrease in the air pollution in this region. Thank you.
Great. That is very interesting. Yes, meteorology definitely plays an important role, and that is why high levels of pollution during winter hours from stubble burning. But considering that so much of research has gone into air pollution levels, action plans have been developed since last 3 years under NCAP. Where are we lagging in terms of improving the air quality levels?
If I talk about how we can improve or where we are lacking, basically, we need to understand that there are few things. One thing is that you make the policy, you make a wish list like we have in NCAP, which was like by 2026. At this moment, basically, we will reduce the PM level by 40 to 60%. So certain effort in terms of, if you look at the technological, they are being taken. Basically, the industry is being asked either to switch it to the clean fuel or also use improved methodology to curb the air pollution. I remember like there is an incinerator, only one incinerator for, you can say, working in Chandigarh. So they have been asked for the improved air pollution control devices and system to be implemented. Now, if we talk about various strategy like greening of the zone where you see the resuspension of the dust, or you can say brooming, which normally take late evening hours. So electronic, basically removing the road dust, they are taking place. But when we talk about, it is not only the pollution control board responsibility, and they need to coordinate or work in collaboration with municipal corporation. So while Chandigarh Pollution Control Committee have their regular staff, those who sit there, but the MC people, they change very rapidly. So how to bring coordination, or you can say synergy, with them is the key. Because as I said, this waste emission, in a city like Chandigarh, it could contribute up to 25 to 35%. Then talking about vehicular, that will also significantly contribute, and we are working in this direction. So the focus is, we are not exactly targeting the low-hanging fruit. Like we can simply implement where there is a construction site, so they need to follow the norms, but they will come up. We do not have sufficient manpower. So these things, if they do not have manpower, they need to engage the community. So we have to understand that three layer. One is administrative, then municipal corporation, and the community. If we work together, we will be able to achieve the desired result in this region.
Thank you so much, sir, for bringing these very important points, and it gives me cue to the next speaker, that is Mr. Sushil Dogra. I'll come back to you in the next round. So, hello, Sushil Dogra ji. Thank you for being part of our panel. And as Professor Ravindra mentioned, that there needs to be synergy. We need to work in coordination with municipal corporations, with various other departments, and it is just not the responsibility of the Pollution Control Board alone, as it is a regulatory body and not an implementation body. So what is going wrong in terms of implementing the strategies on ground? So could you please highlight on those challenges?
Good afternoon, ma'am. Good afternoon, all the experts and the whosoever who joined this workshop. So, ma'am, as Dr. Kheval has said, there are so many challenges which we are facing in Chandigarh, especially with respect to the coordination. Before going to that topic, I just want to highlight some of the key aspects of the city, because this city is beautifully designed. I think this is one of the finest cities in Pan India. So this is a landlocked city. There is no chances of expansion of the city. The two cities which are adjoining to Chandigarh, that is Panchkula as well as in Mohali. The Mohali is a part of Punjab as well as Panchkula is a part of Haryana. So they are very fastly growing cities, and we don't have any control over the quality of air which we are getting from these two cities, because as such, Chandigarh as a regulatory body, there is no industry in Chandigarh, because we are having very minute level of very tiny industries in Chandigarh. We are having only 48 industries which are very little foundries, where you can just see a little. They are all the city, all the 48 type of foundries. They are having proper air pollution control devices in place. One incinerator which Dr. Kheval is talking about, that is the common biomedical waste treatment facility. They are having a very good bag house filters, where they put around 350 small that filters in between the APCD. So we don't find any sort of air pollution from industries within the zone where this air quality is deteriorating. So what we thought that we are getting the pollution in Chandigarh primarily from the vehicles, because the density of vehicles is very high. I think it is per capita ownership of vehicles is leading. Chandigarh is leading in the per capita ownership of vehicles. The second aspect which Dr. Khaiwal is talking about is the coordination. Yes, we are lagging little bit in coordination among the stakeholders of Chandigarh, because municipality, there are so many people who are engaged in doing so many things for improving air quality, and they keeps on changing. So we find a little difficulty in coordinating with the municipality, because I think one of the major other factor which contributing to the air quality is the waste management. Because earlier there were so many there was a company which is called as JP Associates. They are running this RDF plant in sector 38, which is Dedu Majra, which is also called as Dedu Majra. So they are running this plant. Thereafter NC is taken over that plant, and now there is an integrated solid waste management facility which is going to be to come up in Chandigarh, and the process is under litigation under environmental clearance. So soon we'll get the environmental clearance, and as soon as we'll get the environmental clearance, I think we are able to take up this matter of municipal solid waste management. Apart from this, there are so many things. Apart from all these things, we are doing so many things in Chandigarh. The green cover of the city is, I think, 50%. So it is one of the highest in India. So we are having around 47% green cover if we are talking about geographical area. Apart from that, there is a strict enforcement on POC certificates in Chandigarh, because traffic police is very active. They are playing very active role in Chandigarh. If you come to Chandigarh, you follow all the whatever rules are there. So you have to follow that rules. Then there is a proper mechanical road sweepings on different roads. We are having 8 type of roads from V1 to V8. V8 is something which we named it as a road for non-motorized vehicles. So we are having 250 kilometers of well-planned cycle tracks in Chandigarh, and people are using it on a very frequent basis. Then we are having anti-smoke guns, sprinkling is being done, and we are washing the canopies also of the trees. Then legacy waste has been almost around 90% of the legacy has been cleared in Chandigarh. So that is again one of the very good achievements which we have made so far. We are having a proper construction and demolition waste processing facility. The total capacity is around 160 metric tons. So it is again very good, and there are proper bylaws for that also. We are having around 33 sites where people, they may send their waste, that construction and demolition waste, to that locations, and from there municipal corporation, they picked up that waste and sent to the that C&D waste processing facility. And this facility is also located in the industrial area, means well demarcated industrial area. We are having 2 demarcated industrial areas, phase 1 and phase 2, and that is again to the in the southern east part of the city. Then we are having so many vertical gardens we have placed under National Clean Air Program, so that we are able to just minimize the effect of that pollutants on the public health. Then we are having a very good solar network. We just around 91 megawatts of electricity we are generating out of the solar. So it is again one of the very good achievements. There is a complete ban on the burning of waste yes, in the winter seasons, we are getting little complaints from the residents. There are certain burnings of the horticulture waste, but apart from that, there are very little chances we are getting that burning of waste. Then all these things we are taking up in Chandigarh. But yes, of course, I think because of the transboundary movements of the air pollutants, we are getting this because we are not able to, uh, as you have mentioned in your slide, we are just not able to meet the standards, and that quality of air is deteriorating. The other main aspect, because we're having three continuous ambient quality monitoring stations, and those stations are as per the guidelines of Central Pollution Control Board. Apart from that, we are having five manual stations, four in the corners of the city and one in the center. Sector 17 is the center. We are placed in the fashion. But I think there should be auditing of all the continuous semi quality monitoring stations, because many cities they have placed these stations not as per the guidelines. And yes, of course, on that we are not relatable to other cities, because one of the cities in Agra, I visited that city, so they have placed that continuous semi quality on the seventh floor. Then how can they capture the quality of air? So these are some of the issues. And yes, the two issues is transboundary, and another issue is the coordination. I think we are lagging in that and these two parts, two
Thank
areas.
you, Sushilji, for giving that extensive understanding on what is happening in Chandigarh. But again, my point is being I have visited Chandigarh multiple times, and I have myself seen that a lot of construction work is happening on the roads, and all the the debris and the excavated material just lies on the sides of the roads. They are not even covered by green cover. So are we saying that, and you also mentioned that there is a lot of lag in coordination when it comes to involvement of municipal corporation. So is it that air pollution is not priority for the municipal corporation in Chandigarh?
No, no, ma'am. It is always the priority, because there are certain means there are nodal officers from municipal corporation. They are taking lot many actions for the control of air pollution. But if you visit Chandigarh nowadays, you will find that lot of changes have been happening in this area, because as you said, there are lot many heaps of that waste is lying along the road. But nowadays you will not find any heap along the road, except in certain pockets maybe. But yes, they are taking it seriously, because the commissioner, he is also very prone to take the proactive action he has been taken by him. So I think within next 2 3 months we'll see lot many changes. Once the integrated solid waste management facility has been set up in Chandigarh, thereafter you'll find a lot many changes.
Okay, Mr. Sushil, I'll come back to you with some difficult questions in the next round.
Yeah, sure.
I'm sorry. Now I welcome Miss Pavila. Uh, Hello, Miss Pavila. How are you? I have been following you since many years, and you have been actively involved in creating awareness among citizen groups, the right to clean air. You have raised your voice on cutting down of trees. You have created awareness on composting of waste of your kitchen. And then you yourself have carried out a lot of awareness around the Sukna Lake where you collected waste and all those things. Everything was around air pollution and waste management. So could you please highlight like what was the motivation behind this, and do you think that people in Chandigarh are really aware of the bad air pollution in the city?
No. The people in Chandigarh are very happy that they live in a very well planned, rich city of India where every house has two cars per capita, and they are very happy about it. They do not know what is happening outside. This is a city of very educated, very rich people who do not bother what is happening outside their window. And with all due respect to all the very intelligent panelists, I have uh, seen fire burns, garbage burns, leaves burns happening everywhere. Only that now I have stopped posting it socially. Before that, I was very, very vocal and very, very active about it. I would request get up at 4 o'clock in the morning, go stand in your balcony, and you will see, you will smell the air full of smoke because it is burning of leaves. Now you said something about, I have written all whatever you spoke. Okay, you said something about sector 22 and 53. Do you know sector 22 is in the heart of Chandigarh? There is no construction going on over there, but the vehicular traffic in that area is the highest in Chandigarh. That is one of the oldest area of Chandigarh where 90% of shopkeepers started their business there. So sector 22 has the highest density of vehicular traffic in the day because that is Madhya Marg, that is the main road of Chandigarh. Everybody who comes into Chandigarh will cross that area. So again, Sector 53 is the same. Sector 53 has a forest area. I'm sure about it. The people who are listening will agree with me. Where there are continuous fires burning, that is why it is polluted. I have pictures. I have photographs of people burning garbage over there. There is a garbage center also in Sector 52 or 53 where they continuously keep burning garbage. एंड अगर जो हमारे जहां पे कंप्लेन्स होती हैं फायर बर्निंग की और गार्बेज बर्निंग की, अगर वहां पे कंप्लेन्स नहीं आ रही हैं तो इसलिए नहीं आ रही क्योंकि हो नहीं रही हैं, बिकॉज लोगों को फर्क नहीं पड़ता है, दे डोंट केयर एनी मोर. तो सारी लॉज एंड रूल्स चंडीगढ़ में बहुत अच्छी हैं, सब कुछ बहुत बढ़िया है, पर जब तक हम एक कॉन्शियस सिटीजन नहीं बनेंगे कुछ नहीं हो सकता. सी the administration alone cannot do anything. How many people will work? Administration is a handful of 100 people, and they are people, they are officers who come and go in Chandigarh. There is nobody staying in Chandigarh. They have a term. They come for 1 year, 2 year, 3 years. They don't bother, or not. I'm not saying they don't bother. They will move on. How will they see that what rules they have laid down somebody is following them? So despite such wonderful rules being laid down by the administration, and I'm telling you, with no disrespect or to anybody or to say that they're not working, but they cannot do it alone. They need the support of the citizens, a conscious effort from every citizen to make sure that बहुत छोटी छोटी चीजें हैं, that not to burn, not to tell. Every house in Chandigarh has a garden, and believe me, every mali is burning leaves. एक बहुत छोटी सी बात है. कल को मतलब आप बोलोगे कि सेक्टर 9 में तो सिर्फ 10 फायर थी, सेक्टर 18 में 10 थी, ऐसे करते करते ऑल ओवर चंडीगढ़ दिन में 100 लीव्स बर्निंग होती है. इमेजिन दिस little is amounting up to so much. Other than that, also Chandigarh is lying in a very it is at the foothills, so the air that moves around in Chandigarh is very less. So इसी वजह से वो एक एयर कॉन्सेंट्रेट भी हो जाता है और पोल्यूशन लेवल्स बिकम वेरी हाई. एंड मतलब मेरे को ये लगता है कि वी नीड टू बी रियली कॉन्शियस सिटीजन्स. टू शर्म नहीं आनी चाहिए टू स्टॉप अ फायर, शर्म नहीं आनी चाहिए कूड़ा उठाने के लिए. अब साइकिल ट्रैक की बात करते हैं. साइकिल ट्रैक सबसे लंबा साइकिल ट्रैक है चंडीगढ़ में. कितने लोग साइकिल यूज करते हैं? गाड़ी वाले साइकिल ट्रैक यूज करते हैं? नहीं करते हैं. सारे लेबर लोग साइकिल ट्रैक यूज करते हैं. आर दे द वंस कॉजिंग पोल्यूशन? नो, दे आर नॉट द वंस कॉजिंग पोल्यूशन. द साइकिल ट्रैक्स आर एम्प्टी. Can that person who is traveling in a BMW or a Mercedes go on a cycle to his work? No, he will not. Now you will tell me that these are very high end cars and they don't do any emissions. ठीक है, नहीं करते हैं, पर वो साइकिल ट्रैक यूज कितने लोग कर रहे हैं, मुझे पहले ये बताइए. I am very emotional about this environmental thing. और मैंने इसलिए इतना बोलना बंद कर दिया है सोशल मीडिया पे, बिकॉज इसका कोई फायदा ही नहीं हो रहा था. मैं अकेले बोलती जाऊं, बट जब तक हम सब मिलजुट होके ये नहीं कोशिश करेंगे कि छोटी सी चीज है जैसे कि लीव्स बर्न नहीं करना है, अगर वो एक आदमी हर एक घर में माली है चंडीगढ़ में, और हर एक आदमी अपने माली को बोल दे भाई तूने लीव्स बर्न नहीं करनी है. यू गो टू मनी माजरा साइड जहाँ पे सारी के सारी नर्सरीज है. It is a mess. It is a mess. I wish I had the pictures to show you the nurseries outside. There are about 50 nurseries in one way in the IT park, and they all are burning their garbage every day. How can you say कि leaves are not being burnt and garbage is not being burnt? No, it is being burnt. 100% it is being burnt. And चंडीगढ़ के मेन कॉज ऑफ पोल्यूशन ही छोटे से ही हैं, बस 3 ही हैं. एक व्हीकुलर ट्रांसमिशन एग्जॉस्ट फ्यूम्स है, एक कंस्ट्रक्शन है, बिकॉज ऑफकोर्स कंस्ट्रक्शन बहुत ज्यादा हो रही है चंडीगढ़ में, और एक वेस्ट बर्निंग है. 3 ही तो हैं और कुछ है ही नहीं है. दीज आर द मेन कॉजेस. इंडस्ट्री है ही नहीं चंडीगढ़ में. और जब स्टबल बर्न होता है, it will definitely come into Chandigarh because Chandigarh is at the foothill. It is strategically so positioned कि सारा का सारा जो धुआं है वो चंडीगढ़ में आके बस जाता है. So
I want to ask you one thing that I'm sure आपके जैसे बहुत सारे एक्टिव सिटीजन्स भी होंगे चंडीगढ़ में, तो क्या वो एक ग्रुप बना के अवेयरनेस क्रिएशन के लिए म्युनिसिपल काउंसिल के पास नहीं जा सकते हैं? क्या म्युनिसिपल काउंसिल आई एम श्योर अंडर नेशनल क्लीन एयर प्रोग्राम कुछ अवेयरनेस प्रोग्राम कर रहा होगा, एंड जैसे प्रोफेसर खैवाल और सुशील जी ने भी बोला दैट म्युनिसिपल कॉर्पोरेशंस को भी सपोर्ट चाहिए. सो क्या ये चीज नहीं हो सकती चंडीगढ़ में?
See, there are many self-help groups, but जब आती है बात एकजुट होके जाने के लिए, कोई नहीं जाएगा.
Okay.
मुझे बताइए, the esteemed people who are sitting here, I don't know whether they are from which I mean, in what part of the department they are. How many people come to them? How many people go to them? There are so many people in Chandigarh. There are so many self-help groups. आप बिलीव करोगे, मेरे को इतने फोन आते हैं, पवीला ये यहाँ पे ये हो रहा है, यहाँ पे ये हो रहा है. अब मैं जाके कहीं पे कोई पेड़ काट रहा है, मैं कैसे रोकूंगी? आपके सामने पेड़ कट रहा है. सेक्टर 33 में लास्ट ईयर मुझे फोन आया कि पवीला देयर इज अ बिग मैंगो ट्री एंड देयर इज अ जेंटलमैन जिसके घर के आगे आ रहा है एंड देयर कटिंग इट. आप बिलीव करोगे, मैं एक्चुअली वहां पे गई, जब तक मैं गई वो पेड़ कट चुका था. बहुत छोटी सी बात है. आप ऐसे ऐसे करते करते चंडीगढ़ में रोज कोई ना कोई पेड़ काट रहा है, ग्रीन कवर बढ़ रहा है, ट्री कवर बढ़ रहा है, बट उतने कट भी रहे हैं. ऐसा नहीं है. चलो मैं बोलती हूँ, इतने इतने चंडीगढ़ में पेड़ हैं कि हमें ज्यादा शायद फर्क नहीं पड़ेगा, बिकॉज वी स्टिल हैव अ वेरी लार्ज कवर ऑफ ट्री देन मे बी ऑल ऑफ इंडिया. एग्री टू दैट. बट द थिंग इज, ये छोटी सी बात है. आपके सामने पेड़ कट रहा है, रोक लो ना, हाथ पकड़ लो ना उनका. आप वेट क्यों कर रहे हो? Nobody can cut a tree in Chandigarh without a permission. Ask them to show the permission. मैं कहाँ जाऊंगी, आप मुझे बताओ.
Right,
And
right.
I used to go. Generally, I used to go. और जहां पे मुझे अभी तक याद है, रात को 2 बजे फोन आता था कि पवीला यहाँ पे पत्ते जला रहे हैं. I used to tell them, call the fire brigade. बहुत छोटी छोटी बातें, बहुत बहुत सिंपल. देखो, हम जैसे जो सिटीजन है ना, हमारे हाथ में बहुत सिंपल तरीका है. छोटा सा प्यार से प्रोटेस्ट करो, छोटी सी चीज लोगों को समझाओ जो हम कर सकते हैं. But
Correct.
nobody wants to take an initiative because it is a lot of hard work. Administration can only do so much. कितना करेंगे वो? They need the help of people.
Right, right.
It's about 100 people versus 12 lakh people. How will the 100 people of the municipal corporation be able to do something which 12 lakh people are destroying every day?
Right, right. Good, good. Thank you for sharing those points. I'll come back to you. And now I'll go to Dr. Deepak, who is an health expert at Medical College in Chandigarh. Dr. Deepak, welcome to the panel. Yes. Some very important questions raised here in terms of solid biomass burning to keep themselves, heated during the winter times, or burning on leaves, throughout the year. How do you think that it's going to impact health? And Chandigarh being considered as one of the largest green cover in India and a planned city, but the air pollution levels are rising. How does it impact human health?
We all know that air pollution by any means.
Dr. Deepak, could you please adjust your camera? We are not able to see. It's only your forehead that is visible. Yeah, great. Thank you so much.
So air pollution by any means, whether it is by the fuels which are being burned by the vehicular combustion or by burning of the stubble, all these do affect the health in a broader manner. Let's say I'm a pulmonologist, so we see a lot many respiratory diseases patients, and I can tell you almost all the respiratory diseases have some cause being an air pollution behind it. So let it be like a chronic obstructive pulmonary disease, or it is a lung cancer, or it is a pneumonias, or increased in the upper respiratory infections. So air pollution do play its role in causing in all these diseases. Apart from respiratory diseases, even diseases of other systems like cardiovascular diseases, ischemic heart disease, like strokes, all these do have some basis as air pollution causing them. And it has been well proven, and it's there on the WHO website. We can all go and see there that almost all these diseases they are either precipitated or the risk is increased due to air pollution levels. Yeah.
I want to understand, like Chandigarh is, just right beside Punjab, where a lot of stubble burning happens during the month of April and then during October, November period. And obviously Chandigarh is impacted due to the stubble burning, pollution. So does it impact what is the percentage increase in the impact? Have you looked at those numbers?
Yeah, definitely. During these times when there's a stubble burning is going on, and whenever there's a change in the weathers are there, we do get many patients of airway diseases, particularly like an asthma exacerbations, like chronic obstructive pulmonary disease exacerbations. So these diseases, the patients' number do increase during these times. I cannot tell you the exact number, but definitely if I am seeing 100 patients a day, that number increases significantly during these times.
And is there also bifurcation among the women, children, and the elderly percentage share increase during the winter time?
It's not primarily a gender distribution, but primarily because of the more exposures to air pollution being faced by the males, because they are more into the working world and going outside the houses. So that's why they are more prone to develop these diseases, particularly. And women, even though there are a lot many working women in Chandigarh, but yes, many of these homemakers, they do have some exposures at home even by using, if they are using a biomass, which is not very high in Chandigarh because it's a quite an urban city, but definitely in biomass exposures and using or some sort of livestock at home, also they contribute to air pollution at due to home environment.
Okay, interesting. Thank you so much for your input, sir. I'll come back to you again. Dr. Ravindra, are you there? Ravindra, sir, can you hear me? I guess not.
I can call Pratima. Let me call him.
Okay, sure. Okay, he's here. Yes. Yes.
Sorry, my system hanged. I was hearing very well all the discussion actually.
Okay, great. So, we heard some very interesting facts from Ms. Pavila, who mentioned, like Sector 22, there's a lot of small businesses and hence the traffic density is really high. And in Sector 53, there's like a forest where a lot of leaves are burning. So, sir, based on like you mentioned that meteorology definitely plays and it's a landlocked city, Chandigarh. So, what are the probable solution? What are the control measures that the city needs to adopt going forward?
Okay, so we need to understand that as Madam Bali said, engaged citizen. When you talk about engaged citizen, it's basically not just creating awareness, but action. Basically, what we speak that should also reflect in our action somewhere. So I hope you are aware that we are engaged with eco clubs and we create awareness with children and educate them so that they understand the adverse impact of air pollution exposure. So there we are engaging children, and not only this, basically we are engaging through various IEC media, starting from a video to a comic book to many other things actually. So this is how we are, you can say, targeting the future generation because we
Do you
are
have
more.
any comic book of yours right now, which you can just show that we know what type of comic book is
Yeah. So
there?
let me show you this book. It is like YUM Mahakumbh, which is just released in the Vidhan Sabha of Rajasthan. So you will see, oh, is this book about Mahakumbh? No, just go inside and you will see even on the stem page, we are talking how you need to take the precautionary measure. So this booklet is also available in a video mode. And we are also talking about how to minimize your plastic pollution there. Now you will talk about that what is the role of plastic pollution and then linking air pollution. So this is something where we need to understand that if we segregate our waste as a common citizen, we can reduce and or can contribute to minimize the pollution. First thing, if you segregate, it will be a resource and it can be, you can say, reused in a scientific manner. And it will promote also urban mining. So our mining activity, which contributes somewhere air pollution, it will also support that. Second thing, we need to understand that the composting material, if we use only means compostable waste separately, will be useful for urban forestry, which we were talking about that our old trees are falling rapidly because of termite and many other attacks. So what I feel like that engagement of citizen is the key. Now, the second aspect is that the Chandigarh Pollution Control Committee need to identify what are the low-hanging fruit. So sometime we love to monitor, but what is visible basically, as in medical science, Dr. Deepak is there actually. You don't need always those sophisticated instrumentation and you can say test. It is only when something is more visible and when you can treat it without any instrument. I remember in the old days, our GP, they were simply monitoring us and providing the solution. So some solution, Chandigarh administration should work out for this aspect. And these
Right.
solutions are very simple. Like, you know, the major traffic junctions, you know, the major traffic route, and we knew that how we can promote the non-motorized mode of transport. So these things in consultation with the community can be implemented. So once you reduce the vehicular kilometer traveled, you actually reduce the emissions. So that aspect need to be worked out.
Right.
Like during the weekend, many people go to, let's say there is a mall called Elante Mall. So why don't we provide let's say electric buses and other services? We knew during the Shatabdi time, there is a huge traffic crisis there. So normally these buses, they will run, even you come out and only taxi and auto and all, they will be standing there for you to welcome. So why there is no proper check and balance mechanism? So you need to focus on public transport. Then coming to where you see there is a open area, engage community for urban forestry or urban, you can say agriculture or urban something. Like I have seen in Europe where there are pockets where elderly people grow their vegetable and other things. So can we work together so that these pockets, which otherwise simply barren and you can say adding dust to the air, that could be controlled. Now coming to this construction site, it's just that first thing is that regular visit. If regular visit is not possible, we need to engage the various societies. Like there is a various sector, there are various residential worker, you can say welfare association, and they need to be engaged also, that they monitor and they check these things to be followed for you can say control of construction waste. Now, problem as also highlighted by Mr. Dogra is that we are also covered by you can say New Chandigarh and then Mohali also, and also Panchkula. These are the construction site. So now we have to think about that how we promote or work together with Haryana, Punjab, and also slightly with Himachal. So these emissions do not add up to our city emission. We have seen various, you can say, initiative by Punjab government and Haryana government in terms of curbing crop residue management. But Commission is also working in comprehensively in all this region, but something Chandigarh administration could also think about working with nearby districts so that the pollution load could be minimized from the crop residue burning, because it is somehow a combination of you can say crop residue burning, and we only talk during October, November, and as you highlighted specifically during December, when because of the meteorology, I will say mainly the pollution load is high. Interesting thing is that in Chandigarh, if you will note, the pollution increases during evening hours, and that reflect later also. So these peak pollution by the traffic, we have to work it out through public transportation, that how we address this issue. Second, something which I feel should be done is nature-based solution. So how the city think about that something like we have produced a booklet also about how to, and we are interested to work with the Chandigarh administration to show the role model or case model minimizing the pollution. But we have just published our booklet and paper and we are satisfied. We need partnership basically. So scientists should be regarded and should be engaged in pollution. And where there is a need, NGOs, like I'm saying, Madam Bali, yourself, and other could be also partner. So they should also be made partner for such program. So these are the few things which I wish to highlight here. Thank you.
Thank you, Professor Ravindra. Very interesting points, and I do support nature-based solution. That is something Mission Life also talks about. So we should start looking into it. But yes, my next question will be on like how do we engage? Because as Bali madam also said that not everyone can is willing to engage with the administration, or they don't know what are the ways to engage. That is something we will have to discuss, and then probably engage with municipal bodies and then find a solution. Thank you so much. I'll come back to you for the final round. Moving to Mr. Sushil. So I want to understand that Mohali is a twin city, and when it comes to the infrastructure of Chandigarh and Mohali, which are like almost attached, and Mohali is extremely polluting. There are a lot of industries. The infrastructure is really bad, and the air, obviously it is polluting both the cities simultaneously. So is there any way that Chandigarh could adopt Mohali and work on the infrastructure or the regulatory measures so that Chandigarh stays healthy?
Yes, yes, of course, ma'am. The state action plan, ma'am, recently, which is there in one of the orders of Honorable National Green Tribunal, they have ordered that every state has to make their state action plans. So we have made that plan, and on the tune of NCR regions, we have made a plan. We have made a coordination committee with the Panchkula as well as of Mohali, so that there should be a tri-city approach rather than we are doing alone in Chandigarh. We have to take this approach. Only then we are able to, I think, curb the pollution levels in this region. So we are taking up this matter, and soon we'll put this before the chief secretary. I think within next 10 days we'll hold a meeting of steering committee, and we put this in the meeting. And I think by tomorrow we'll send this station plan to Delhi. So we have already taken up this matter in that station action plan, and I think this would help in improving the quality of air.
Very interesting point. I just asked you out of curiosity, and I had no clue that this is already in process.
Yes.
Very interesting. I would also want to understand, like, what are the initiatives that is taken by Chandigarh Pollution Control Committee in terms of creating awareness? Because today we are here on this webinar, which talks about creating awareness among citizen groups who does not understand science. And pollution control committees, they understand science, but what are the measures and what are the possible solutions for creating awareness?
Chandigarh, every school in Chandigarh, there are around 150 eco clubs, as Dr. Keval has said. There are 150 schools, the 150 eco clubs in Chandigarh. So we have taken all the eco clubs on board, and through their nodal officers, we have penetrated to each school so that every children, they may understand the importance of the good air, the quality of air. So this is the one way we are addressing this issue. The another is every stakeholder department, we have made one nodal officer, and in every program, whatever they do, we put one of the component, that is air pollution, in every aspect, because it maybe because lifestyle for environment is again one of the maybe a main agenda, that is also the air quality. So in that way, otherwise RWs, we have made so many awareness programs among RWs also. So in every part of city, wherever there is a fest, we put these sort of slogans, we put so many banners. Apart from that, we have placed so many screens in Chandigarh, around 7 big screens we have placed in different parts of the city, where we have shown the air quality index to the citizens so that they may be aware and what they need to do. We are also putting that on the screen. So this way we are trying to help create awareness from social media, through the print media, through other sources of medias. We are trying to penetrate among the citizens of Chandigarh. So this way we are putting all the things.
Interesting. Thank you so much for highlighting those experts, points on the awareness programs. I think we could do more while,
Yes, definitely.
engaging with the
Yes, yes.
citizen groups.
This is a very
Like,
good suggestion, a very good suggestion given by Dr. Keval, कि we should make a group where we we take the help of the NGOs, the experts in this field, as well as the citizens of Chandigarh. तो वैसे इसको मैं before the steering committee, I put one of the agendas as to put before the chief secretary, so that we can take it formally on board.
perfect. Thank you so much. And that is the objective of our webinar also, to create awareness. And if a step is taken towards it, it's like one step ahead in our objective. Great. Thank you so much. Now I'll move to Pavila ma'am. Ma'am, you had mentioned that there are rich and educated people in Chandigarh. However, they are not concerned about the air pollution levels. So I would want to understand, like Professor Khewal also mentioned, that we should be moving towards public transportation. There needs to be e-vehicles which can take you to malls and other places. But Chandigarh is known for high-end vehicles. Everyone has, like, as you mentioned, 2 to 3 vehicles in their backyard. So how do we change the behavioral aspect? How do we ensure that people start thinking about the environment and just not about their status or the luxury?
I don't know, but these are the same people, including me. When we go abroad, we will travel by tube everywhere. We will travel by public transport everywhere. Maybe it's because the quality of the public transport and the safety is there. और कोई रीजन नहीं हो सकता, बिकॉज हमारे पास भी इंडिया में भी इतने रिसोर्सेज हैं कि हम बहुत अच्छी पब्लिक ट्रांसपोर्ट कर सकते हैं. बट एक उसमें जो लोगों को हिच आती है is about the cleanliness of the public transport and about the safety. These are two things why people don't use public transport in India so much. I mean, I'm talking about the middle class and the upper middle class will very rarely use public transport, and that constitutes a very large number of population. What I'm trying to say is our administration built a cycle track at a lot of cost, and we are very proud that we have one of the longest cycle track in India. I implore the administration, why aren't those people going to work on cycle? The mayor of London goes to his office on cycle. यहाँ पे एक बार ही हुआ, उसके बाद रुक गया. आई एम नॉट ट्राइंग टू क्रिटिसाइज एनीबडी. आई एम सेइंग मैं डालने को तैयार हूं, पर मैं अकेले कुछ नहीं कर सकती. आप सी हमारी साइकिल ट्रैक पे कौन चल रहा है? कोई साइकिल ट्रैक यूज ही नहीं हो रही है. इट इज बीइंग यूज्ड बाय द लेबर क्लास पीपल और बाय द पीपल हु आर वॉकिंग. दैट साइकिल ट्रैक एटलीस्ट हमारी सक्सेस तब बनेगी जब हम कन्वर्ट कर पाएंगे एटलीस्ट 5% of those people who are traveling in luxury cars to go by cycle to work that day. How many people will go? Right. Nobody will go. So एक छोटी सी पहल है. पहले साइकिल ट्रैक को तो जो आपने इतनी अच्छी सी बनाई है, इतनी मेहनत से बनाई, उसको तो यूज करना शुरू करें. How many people are using the cycle track? आप एक दिन बना लो भाई. आज तो फ्राइडे को all those people who use cycles will be given incentives. Something should be done ना. कुछ तो करना पड़ेगा भाई. साइकिल ट्रैक पे there are about very big cycle groups in Chandigarh. Very happy cycle groups. सुबह 100-200 लोग निकल जाते हैं सुबह 4 बजे, वो डैम तक होके वापस आ जाते हैं, साइकिल अपनी घर में खड़े करके फिर गाड़ी उठा के काम पे चले जाते हैं. What is the point? I want to understand.
Right. Yeah, the cycle tracks are made because the number of the vehicles flying on the road should reduce, but the objective is not met.
Yes.
It is just a mere hobby. People,
अगर आपने सिर्फ
take
टिक
it
मार्क
on
करना है
Sundays.
कि चंडीगढ़ इज अ ग्रीन, वो क्या होता है ना, बट स्मार्ट सिटी टिक मार्क करना है कि स्मार्ट सिटी में एक साइकिल ट्रैक होना चाहिए, तो देन वी आर वेरी हैप्पी. बट अगर उसको आप यूज में नहीं लेके आओगे तो क्या फायदा हुआ? मुझे बताइए.
Right. Very, very, very valid point, and probably this is where the awareness will help, and the administration should come out with some incentivization. Like in Chennai,
सैटरडे संडे को मत करो. सैटरडे
Right,
संडे को मत करो कि भाई साइकिल चलाओ, तो ऑफिस ही नहीं चल रहे थे. यू डू ऑन द बिजिएस्ट डे ऑफ द वीक ना. डू ऑन अ मंडे, डू ऑन अ वेडनेसडे. बोलो कि भाई आज वी आर प्रमोटिंग people who are living in sector 22 will go on cycles. See how 22 में vehicular pollution कम हो जाएगा. थोड़ा सा तो लॉज रूल्स कुछ तो करो ना. इतनी लंबी लंबी साइकिल ट्रैक बना दी है और साइकिल ट्रैक पे लोग चल रहे हैं, कूड़ा जल रहा है, पर साइकिल नहीं चल रही है.
Right. No, this is an interesting point, that incentivization should work, because in Tamil Nadu this has worked. In Tamil Nadu, the Pollution Control Board has provided incentives to their employees for using public transportation on Tuesday. So this kind of incentivization should come from the government side, which will help the citizens. Great, thank you. Is there anything else that you would want to contribute in terms of behavioral change? I am very much eager on that, because you run this run club where all females are taking part. Do you also talk to them about the health impacts they are facing due to air pollution?
पता तो सबको ही है ना, पर इम्प्लीमेंट कौन करेगा, है ना। एक और आपने कुछ अभी बोला जो मेरे दिमाग से निकल गया क्या, हाँ, अभी वन द जेंटलमैन वर टॉकिंग, दे सेड दैट देयर आर मेनी प्लेसेस वेयर कंस्ट्रक्शन बिल्डिंग मटेरियल जो मलबा होता है वो हम जाके डाल सकते हैं,
Sandy
है ना।
facilities.
मैं बहुत छोटी सी बात बताती हूँ, दिस नंबर शुड बी फ्लैशिंग ऑल ओवर चंडीगढ़, बिकॉज जितनी कंस्ट्रक्शन चंडीगढ़ में हो रही है कहीं नहीं हो रही है। सो मैं बोलती हूँ आप बोल रहे हो कि 4-5 साइट्स हैं जहां पे हम जाके मलबा डाल सकते हैं, पर मेरे को तो नहीं पता नंबर, मुझे पता है मैं अपने जो आर्किटेक्ट है जो मेरे जो साइट पे काम कर रहा है उसको पूछ लूंगी, वो डाल रहे हैं कि नहीं डाल रहे हैं, आई डोंट नो, बट आई थिंक ये जो एक बात उन्होंने बोली कि देयर इज वी हैव 4-5 साइट्स इन चंडीगढ़ वेयर यू कैन गिव योर कंस्ट्रक्शन वेस्ट, सो आई थिंक दिस एक छोटी सी बात है, मुझे नहीं पता था। तो नंबर्स दे शुड बी फ्लैश्ड एवरीवेयर, एंड एक रेडियो पे मुहिम चलाएं कि आपके घर में कंस्ट्रक्शन हो रही है, जहां पे भी कंस्ट्रक्शन हो रही है, कंस्ट्रक्शन वेस्ट प्लीज इस जगह पे डाल दीजिए। And also, 3-4 more helpline numbers where we can complain about environmental, bad things happening. Some numbers should be flashed by people कि भाई ये एक म्यूनसिपल का नंबर है जहाँ पे आपको लग रहा है कि कूड़ा जल रहा है, आप यहाँ पे फोन करिए। अगर आप चाहते हो कि कोई आपका जो मलबा है उठा के ले जाए, यहाँ पे फोन करिए। तो ये 2-3 नंबर्स फ्लैश करने चाहिए so that we come to know about it. I had not known about this.
Very interesting points, and I'm sure Mr. Shushil is taking note of all this,
Yes,
because these are valid, and this will definitely help to create awareness.
these,
Like,
these
which
are
are
not
the
like,
C.
these are not 4-5 sites. There are 33 sites in Chandigarh where you
Yeah,
can
but
keep
then nobody is
storing.
aware of it, so it would
Yeah.
be good to
Yes,
create awareness on that.
there's one application also which has been made by the municipal corporation, that is I am Chandigarh. It's a very simple application where you can put all the complaints, whatever you are having, you can put that put your queries on that I am Chandigarh app, and you get the solutions to that complaint or whatever suggestions you are having.
So I am going to do something that ये आपने जो बताया है, I am going to promote this on my social media. Yeah, I am Chandigarh app because I never knew about it. I want people
Okay.
to know about it. I am going to promote this and let people know that they can put their complaints in there and make a difference.
Okay. Thank you, ma'am.
Perfect. This is the best platform, and I am really enjoying this webinar. I'll now go to Dr. Deepak for the last round. Dr. Deepak, I would want to understand that have you looked at, or have you carried out any analysis, like the patients that visit you, from which pocket you get the highest number of patients due to or respiratory challenges?
Uh, Chandigarh as such is not a very big city, so it's very difficult to divide the patients based on the sectors. Being a tertiary care hospital, we get a lot of referral from outside the Chandigarh. So we're getting patients from Punjab, Haryana, Himachal, besides Chandigarh. So it's not possible to divide the patients within the sectors. But as such, yeah, just to reiterate the same thing, everybody has to do its own bit. So in our OPD as well, when sometimes the patient do come to us and they themselves are saying that कि सर कि डॉक्टर साहब की ये अब आजकल पोल्यूशन बहुत ज़्यादा है इसलिए मेरी दिक्कत बढ़ गई है. So the patients themselves also know that the pollution is the culprit of their condition. And many of times the farmers are also coming to us and they're saying that कि yes कि pollution की वजह से है और ये जो हम फसल जलाते हैं इससे भी है. So people are aware. It's only that we have to be more aggressive in doing our own part at our own level. So that's the main thing.
डॉक्टर दीपक, डॉक्टर्स जब बोलते हैं तो जनता सुनती है, बिकॉज इट कम्स फ्रॉम अ वेरी रिलायबल सोर्स, रिलायबल इंस्टीट्यूशन है डॉक्टर्स कम्युनिटी जो होती है. तो क्या आप भी अवेयरनेस क्रिएट करते हैं अपने पेशेंट्स के, जो भी आप विजिट करते हैं, कि उनको क्या नहीं करना चाहिए, क्या एक्टिविटीज नहीं करनी चाहिए जिससे एयर पोल्यूशन खराब ना हो सिटी का?
Definitely, primary prevention is always the part of treatment in any disease. So primary prevention में क्योंकि हमारे पास ज़्यादातर respiratory patients आ रहे हैं, so these patients are either having some exposures to dust or pollution, or they are smoking. So tobacco smoking is very prevalent in patients in these patients. So ये हमारी consultation का this is an important part of our management. When the patients do come to us, we always reiterate and reinforce that कि किसी भी तरह का exposure at home or at workplace नहीं होना चाहिए, because many of these diseases are have some basis behind this, and the patients do understand. many of our diseases are linked with occupations. Patients जो कई लोग हैं जो laborers हैं, they are working with the construction sites. They don't know कि वहाँ पे क्या क्या पोल्यूशन हो रहा है, उससे कैसे बचा जा सकता है. तो ना केवल हमने उसको रोकना है, बल्कि हमने ये भी उनको बताना है कि अगर वो पोल्यूशन हो रहा है तो आपने उससे कैसे बचना है, so that you do not get affected by the same levels of pollution.
Correct, great. Yes, occupational hazard is one of the challenges, and there's a lot of research happening in this area, and guidelines being developed. So hopefully, in the coming years, we will have a proper set of guidelines for different type of occupation where air pollution is a challenge. Thank you, Dr. Deepak. For final round, I'll quickly come to Professor Ravindra. In 30 seconds, if you could say, in next 1 year, what should Chandigarh do to improve its air quality level?
Implement NCAP. That's it.
Perfect. Thank you so much. Okay, Mr. Sushil, 30 seconds. What should be the next 1 year action plan for Chandigarh Pollution Committee?
Ma'am, we have onboard all the stakeholders and tried to make a blend of the policy as well as whatever suggestions, the blend of policy, innovation, public involvement. The blend of all these things will make work for Chandigarh.
Great,
And
thank you so much.
Professor sir, we are also taking lot many actions in Chandigarh. So we are implementing NCAP, sir.
Great. Coming to you, Pavila ma'am, what would be your action item in the coming 1 year for Chandigarh? I'm sure you are going to promote I am Chandigarh, but
Yes,
apart
I
from
am.
that.
I'm already finding the app on my right now while I'm already downloading the app also. So what I mean to say, हम तो जो अपने आप करते सो करते हैं. मैं चाहूंगी जो हमारी एडमिनिस्ट्रेशन है थोड़ा सा एडवर्टाइज और करें अबाउट पीपल बीइंग इन्वॉल्व. बहुत फर्क पड़ता है जब हम सुनते हैं ना कि हमें पता है भाई ये कलर रेड है, पर हमें कोई आके बोलेगा नहीं नहीं अब ये बहुत ज्यादा रेड है तो हम सुनेंगे. सो people need to hear it. I would really wish the administration जैसे रेडियो पे रोज मतलब एटलीस्ट दिन 4 बारी निकालें. और मैं चाहती हूँ प्लेकार्ड्स लगाएं दैट imploring citizens to be more involved citizens in controlling the air quality of Chandigarh. And a little bit मैं चाहूंगी कि वो जो आपके कुछ आपके नंबर्स हैं, हेल्पलाइन नंबर्स हैं जो जैसे मुझे भी नहीं पता था अभी पता चला, तो ऐसी चीजों को थोड़ा और एडवर्टाइज करें ताकि लोगों को आसान हो जाए कोई भी गलत चीज हो रही हो उसको रोकने के लिए एंड हेल्प लेने के लिए. थोड़ा सा एडमिनिस्ट्रेशन थोड़ा हेल्प करेगी एंड थोड़ा पुश करेगी तो लोग करेंगे करेंगे.
Great, thank you so much. Dr. Deepak, what would be your, coming 1 year objective for ensuring that, all the patients, they keep away from, getting, affected by the air pollution? You're on mute, sir.
So, जैसे मैं हर बार एडवाइस करता हूँ to follow the primary preventive measures, healthy lifestyle, whatever the doctor is saying, do follow the instructions. And regarding pollution, abstinence from all sort of addictions like smoking. So this is what I reinforce and I will keep on doing it.
Perfect. Thank you so much. Thank you, everyone. We have one question for Pavila ma'am. Somebody has mentioned that you mentioned the desperate need for public action. What do you think are some ways in which we can raise the level of awareness? How can we convince people to drop their high-end cars and switch to using Chandigarh's extensive cycling network?
तो फिर दिस इज द वर्क ऑफ द एडमिनिस्ट्रेशन ना. यू हैव टू प्रोवाइड अस. अभी सबने बोला ही है कि वी पब्लिक ट्रांसपोर्ट नीड्स टू बी नीड्स और पब्लिक ट्रांसपोर्ट की जरूरत है. एंड जब आपको एक सिटी के बारे में पता है तो ऐसी पब्लिक ट्रांसपोर्ट दो प्रोवाइड करो जो सेफ हो. 90% ऑफ पीपल लाइक मी विल ऑल्सो नॉट यूज द पब्लिक ट्रांसपोर्ट बिकॉज हमें सेफ्टी का बहुत इशू है. तो ऐसी कोई बात नहीं है कि हम यूज नहीं करेंगे, हम करेंगे, बट थोड़े से हमें पैरामीटर्स अच्छे दे दो. एंड मैं तो बोलती हूँ प्रमोट वॉकिंग. चंडीगढ़ इतना छोटा शहर है, मैं रोज 10 किलोमीटर चलती हूँ. तो इट इज सच अ स्मॉल सिटी. द होल सिटी इज ओनली 114 स्क्वायर किलोमीटर्स. promote walking, promote cycling. The administration can do it. ऐसी कोई बात ही नहीं है. चंडीगढ़ मतलब citizens को involve करो, involve the high and the mighty and the more popular and the famous people of Chandigarh. They will bring people along.
Right, right. Thank you so much for that enthusiastic participation, Pavila ma'am. We really appreciate that. Over to you, Shreya.
It's a pleasure having all of you. Thank you so much. We hope that this is the beginning of many more conversations together, and we'll loop you into all of our future work going forward on our air pollution campaign. Many thanks to all the panelists.
Thank you, everyone. Thank you, Professor Ravendra, Sushil ji, Dr. Deepak, and Pavila ma'am.